I understand this costs a little bit more than you were prepared to pay. Could you put that on a credit card?
9 years ago, that was kind of your only option, was pay cash or put it on a credit card. Today, we're reacting to dental-specific sales objections from 10 years ago.
Next time the patient says, I'm only doing what the insurance allows, I want you to just very caringly look at them and say, I fully understand. I have a question. Do you want to keep your teeth?
And these are absolutely crazy.
This is a patient that comes in every time there's pain, so we're doing shotgun dentistry.
I had a phone in the consult room, and I would pick up the phone and I say, so what's his number?
All right, we are live, and I got my friend here, Dr. Emily. Dr. Emily, why don't you just tell us a little bit about yourself? Because I know you're a dentist, but you're a lot more than a dentist.
Well, I'm the best mom in the world, and thank you so much for inviting me on here. I really appreciate you creating this platform so we can share with our colleagues. I own 3 practices in Southern California, multi-specialty group practices. Been in dentistry for 31, going on 32 years. And I also do coaching and consulting, helping dentists increase net profit.
So 3 practices now. Not too long ago, it was 2 practices. So you got another one recently.
Yes.
That's awesome. Awesome. All right. So what we're going to do is I got some sales videos here. Dr. Emily has not seen these. I haven't shared them with her, and she's gracious enough to watch them and tell us what she thinks. Now, the first 3 that I'm going to share with you, these are old. So these are from 9 years ago. So that doesn't make them bad, right? Maybe,
Right.
Certain sales things are really, really good, but some are not good, right? Some things age out, and some things we get better and we learn new things. So I'm going to play this first one, and then I want to get your take on it, all right?
Okay.
All right, here
So
we
when
go.
the patient says, I have no money, what I would like to say is, I understand this costs a little bit more than you were prepared to pay. Could you put that on a credit card? Now, doctor, I know that may give you a little bit of a nervous stomach, but it's what has to be done. If you really care about them and you really believe that they need this treatment.
Okay, what do you think about that?
Well, I would disagree on agreeing with the patient. I understand that it costs a lot. I would always lead with value. Because if the patient understands the value, we're going to lose a tooth or we can't chew or whatever, then the cost always come later. Actually, when I do my exam, I tell them we are not talking about insurance. We're not talking about cost. We're only going to talk about you. And that would kind of set up pre-frame that don't ask me about insurance. Don't ask me about money. You concentrate on you, your health, your teeth. And then we can leak with all the other ones. But yeah, I would not say, I understand that it costs more than you expect.
Got it. Yeah, because the cost is only a problem in the absence of value, right? Now, what about the credit card thing? To me, that was the biggest glaring thing to me. It was like, hey, let's put it on a credit card. I'm like, see, 9 years ago, that was kind of your only option, was pay cash or put it on a credit card. Now there's so many other options out there.
Yes.
And credit card's probably one of the worst ones because it costs the doctor a lot of money. Plus you're going to pay a boatload of interest on it.
Yes, I think that's the assumption that, that the patient doesn't have money, that the patient need to use a credit card. You don't know how much money people have. You don't know who they know. Like a lot of time, like I treat older patients, the kids can sometimes front the whole amount for mom and dad. So I think that's an assumption, and I try not to use assumption. It would be more like options. We have several ways to pay. What would you prefer? And then you can list a couple.
Okay, that's really good. That was really good. Okay, learned something there. All right, all right. Here's another one. Same thing, 9 years ago. Okay.
Here's what I want you to do is the next time the patient says, I'm only doing what the insurance allows, I want you to just very caringly look at them and say, I fully understand. I have a question. Do you want to keep your teeth? Because you really have to start to establish what you're dealing with here from the patient's viewpoint. Do they have teeth more important than insurance, or is insurance more important than teeth? And when you ask that question, do you want to keep your teeth? Their answer is going to let you know which category they fall into. Now, there are obviously shades of gray in the middle. But the answer for you is really simple. If they say, I do want to keep my teeth, but I don't want to spend any money or whatever, it's very simple. You say, well, here's the problem. You need $5,000 worth of dentistry, and the insurance is only going to pay $1,000 a year. I will never catch up because things will break down. And in the meantime, as we're dragging this out, you could lose teeth. Most people will say, I don't want that to happen. You just say, good, I'm going to set this over to the side, the insurance plan, and I'm going to tell you what you need. So, doctor, be caring.
All right. What do you think of that?
Well, similar to the last one, like I said, I would always lead with the value. I don't tend to ask people, do you want to keep your teeth? I ask more, you're in here, you care about your health, right? Or maybe you're going to a wedding or whatever the chief complaint is, the
Yeah.
chief concern is why they're there. And then I would say, this is the best way for me to serve you. This is the best way to get you to wherever you want. So maybe it's all on four or whatever it is, right? Could be 20, 30,000, or maybe it's just 5, 6,000. But I said, this is what I would recommend to get you to where you want your goals. And after I explain all of that, then of course the patient, or sometimes they jump right in, does my insurance cover this? I would tell them, okay, we're going to explain all this first before we talk about your insurance. I don't talk about money myself, but if I do, I would say, your insurance is a good insurance, make them feel good, right? Make the patient feel good. It's a great insurance. It covers some, but not everything. So in this case, it's going to cover X, and you should invest to do the rest of it. And I recommend doing the treatment now instead of waiting for the insurance to cover over the years.
Awesome. Okay.
Yeah.
Good stuff. Good stuff. All right. Let's look at this next one.
So I had to come up with a way to very politely find out, are you telling me the truth? So what I did very politely say, I completely understand. This is a big decision. I have a quick question though. You're going to tell Henry that you need $5,000 worth of dentistry. You know him better than anybody in the world. What do you predict he's going to say? Then I would usually get the spouse to talk to me. Oftentimes, Martha would look at me and say, well, he's going to ask me if I want to do it. And then my next question is, do you? And she would say, am I going to have to get a shot? You're not going to grind all the enamel off my teeth, are you? So I have to check with Henry. Was a bit of a smoke screen to, I don't like needles and I don't want all the enamel ground off my teeth. Now, obviously, there will be the time when you say, what is Henry going to say? I say, I have absolutely no idea. That's why I need to speak with him. Good. I had a phone in the consult room, and I would pick up the phone and I say, so what's his number? And today with cell phones, we know that the spouse is going to usually be available. I will tell you this, I never failed to get the patient signed up for what they needed when I got the spouse on the phone. So if that was going to happen.
So he's talking about smoke screens, right? So the most famous one is I got to ask my spouse, right? Like that's usually the most famous one. But that usually, and the reason it's called a smoke screen, it's not that they're not going to go talk to their spouse, but they probably already told their spouse that they're going to the dentist. They really are scared of something else and they don't want to say that, right? So that's I just wanted to frame that. So what are your thoughts on the way he dealt with that?
Well, I think what I do is I empower the patient, right? I make sure that I give the patient everything that they can take in so they can make their own decision. So let's say it's the wife. The wife already made the decision. I want to do X, right? And then if she brings up, I have to go ask my spouse, I would actually ask, okay, what do you need to ask your spouse about? Because sometimes they would say it's money, right? Sometimes it's, well, my spouse is going to be the one that have to bring me, or if with the coaching background, I tend to ask more questions than just one or two. And I would look at the patient history also. So if this is a patient that come in every time there's pain, but so we're doing what is that called, shotgun dentistry, right? We see her every time she has pain, but she hasn't commit. I would take that into consideration. It looks like you've been coming here for 3 years and we only did one filling at a time. What else is stopping you from starting the treatment so we can get your mouth into a healthy state, and so we don't have these surprise or emergency visit. So I think before you get the other person in, make sure that you have already covered everything else, right? Because then they introduce the spouse, and a lot of time it might be a legitimate reason because the spouse is the one making the payments, or the spouse is going to be the one applying for financing. So I understand what he's saying when the patient say that, but I think if we already had that conversation before, but we already asked all those questions, when she actually tell you that reason, it may be a legitimate reason. And I do the same thing with the patient in the chair. Would you like to ask him right now? right? And then of course it's like, oh, he's at work right now. so
Yeah.
so I would say, well, okay, well, we can call him in a moment, or whatever it is.
Got it. Okay. Awesome. All
Mhm.
right. Now I'm going to give you one. This is a little bit different. So this is more of like modern day sales, but it's not dental. So this is
Mhm.
somebody who is you're probably familiar with. I know you like a lot of these guys online. I know you're a big Dan Kennedy fan, and the guy I'm going to show you right now kind of runs in those similar circles. So I think you're going to like him. Maybe you won't, but I want to see first of all what you think about what he's saying, because he is explaining something about emotional intelligence when it comes to sales. And then I want your dental spin on it, because I
Mhm.
know dentistry is different, right? And dentists also, what do dentists hate, Dr. Emily? They hate sales, right? So
Mhm.
like
Right.
even saying sales and sales techniques, like dentists just run from that. I know you don't have that mindset, but and I also know that, just for the audience, you're in a really competitive area. You're in Southern California. You're high taxes, high labor cost, high rent cost, right? But at the same time, I also know that you're a very ethical and fair dentist, and so you have like the perfect combination to be able to speak to this. So let me share this.
One of my favorite ways to close someone is to just say whatever thing they said they're struggling with that they're not sure about, you just say, hey, in a hypothetical world where that didn't exist, would you say yes? And whatever it is, if that thing doesn't exist and they say sure, then you literally now have only one thing you need to solve to get the sale, right? So if you're tired of having people give you obstacle after obstacle after obstacle, you just say, hey, if you had the time, would you do it? And if they say yes, then it's like, cool, let's figure out how to get you the time, right? And then you can solve one problem and make the deal. And the same thing is, hey, if your wife were on board, would you do it? Okay, cool. Then what do we need to do to figure out so she wouldn't be worried about it, right? And so whatever the thing is, you just say, hey, in a hypothetical world where that didn't exist, would you do it? Cool. And then you can close the one isolated variable to get the deal done.
All right, so this is similar to the last one I just shared with you, just presented in a short form content, straight to the point.
Mhm.
So what are your thoughts on that one?
Yeah, I actually learned about this in NLP, when they say, if you didn't have that, would you do this, right? And I think this style is very straight, like in your face, right? Direct, like ask the direct question. So the person has to either agree with you or disagree with you, or admit to whatever they say, whether it's the truth or not. Um, I have no problem with this particular style. I'll tell you, I did this with one of the patient who kept coming in, and we would do an exam, and then she doesn't really go through with it. So the very last time she came in, I actually said, will you be starting treatment today, or are you not? Because if you're not, then I'm not sure we need to do the exam, the comprehensive exam. And she got really upset, right? She got she got really, why did you say that? And I said, oh, it's just we've been doing this comprehensive exam a couple times, right? And then we get to where she was afraid of the dentist, right? Like you explain all the fees, and then she'll make an appointment and she no show, and then she'll come back. So she'll come back in again. So I think, honestly, I think this kind of fall on the dentist. Do you have the courage to just ask the patient what you need to know, and can you take no for an answer? I think that's gonna help everybody.
Yeah, because it's interesting, because in dental, kind of the catch-all for dental is like they're just shoppers. So everybody says, if
Hmm.
anybody says no, it's like they're shoppers. And it's like, well, yeah, everybody's a shopper, right? Like every
Right,
dentist that
right,
I've ever worked with, everyone, they're all shoppers, every one of them. That doesn't mean
right.
they're poor. That doesn't mean they don't have money. That doesn't mean they're not smart and don't understand what I'm saying. It just means they're looking for value. And so a
Hmm.
lot of times what happens is, and you said this earlier on, it was spot on, is like really what you're missing the point on is you haven't presented enough value yet,
Hmm.
and the patient doesn't understand why they should be doing the treatment that you're presenting. But instead what teams do is they just go, oh, they're just shoppers, they're just shopping around. And it's like, yeah, that's exactly what they're doing. They're shopping around for dentistry. That's exactly right.
But that's normal, right? Like that's normal behavior. I will tell you, when a patient is in the chair, and and we know through them chatting with the staff that they've seen 2 3 people. One of the thing I say is, well, let me see if I can help you stay here and start a treatment. So it's a pre-framing,
Yeah.
right?
You're
And
you're
then
explaining to them what your goal is.
yeah, because I don't even ask them why you left the last one. 'Cause, I mean, we have that on the questionnaire, and a lot of people just leave it blank anyway, right? Like reason for leaving the last dentist, they leave it blank. So, but it's there. Sometimes they put something there. But I would start there. Uh, I know that you told Claudia that you have seen a couple of doctors in the past few days. Let's go ahead and do this exam, and let's see if I can help you stay here, and let's start on something today, right? And then I always will go to their chief complaint and give them a solution right there. Okay, for that tooth on the lower left, it will need a crown, it may need a root canal, right? And then, so that at least they go, okay, that's a solution for that. Then I can tell them about the rest of the mouth. When we present fees, like the other gentleman was saying, the fee is going to be first for that particular tooth, and then the fee will be for the comprehensive treatment. And we advise them, it's best to go ahead and do the comprehensive treatment, um, and we have option for you to pick. So I think, for me, a lot of time and this goes with everything you do, right? If you're a straightforward kind of person, you are like that in your dental office. You may do that when you go shopping for a house, or or with your spouse or your kids. So it's more understanding who you are, right, and what you're comfortable with. If you're not comfortable being direct, be the clinician. Then just go ahead and explain the treatment, and let your team do it. I have team members who come in. I said it's a difficult patient. This is years ago, and she would come in and she goes, "There are only two options," right? And she acted very, like a boss, and that's okay. This is when I was 20 some years old. I wasn't ready to do that. But now, if I have a difficult patient, somebody who just kind of wasting our time, I may lead with that. I may come in and say, you know what, get started on that too today. And if they say no, then I said, then maybe we're not the right office for you. Because what do you want to do? Bring the patient in for another 30 minutes and knowing that you're not going to do anything, right?
That's really good. If someone wants to connect with you and learn more about the services that you offer and how you help dentists, what's the best way to get in contact with you?
Yeah, they can go to coachroi.com. It's a page where they can answer a couple of questions, so I can know what's the main concern, which area they want to grow, and then they can book an appointment with me. So when we get on the call, we're going to be addressing what is the main concern, just like when we're doing the dental exam. Let's talk about that first. Let's talk about what's moving the needle for a dental patient. Let's talk about how to make you happier and not have pain, which are usually the two reasons why they in to see us.
Awesome. Thank you so much for coming on. I really appreciate it. And you did a great job as always. Thank you so much, Dr. Emily.
Thank you.
All right,
Thank
bye-bye.
you. Bye-bye.